Would you like me to put the bio up now?
Sure, I'll follow your lead. So you just tell me what you want me to do.
Okay, it's on the screen now.
Do you want me to start or do you want to introduce me?
Oh, I thought you were going to introduce yourself.
That's fine.
Okay.
Okay. Hi, everyone. Welcome. My name is Laurie Marie Pisciotta, and I'm the Executive Director of the Mental Health Association of Rhode Island. Thank you for attending this workshop. My aim is to provide you with an overview of the concept of an Olmstead plan and what an Olmstead plan could do for Rhode Islanders. Really, every single one of us is at risk of unnecessary institutionalization, either through the possibility of having an accident or as we get older. So it's important to each one of us to understand what it means and to understand the implications of not having an Olmstead plan in Rhode Island. So first, I will just tell you a little bit about the Mental Health Association of Rhode Island. Do you have the PowerPoint or do you want me to share my screen?
Either way, I have the PowerPoint or you could share your screen. It's up to you.
Okay, let me see. I will share my screen if that's easier.
Okay, thank you.
Of course. Okay. Okay. So let me just click on view. There we go. Okay. So the Mental Health Association is a small nonprofit based in Providence. We were founded in 1916 by Clifford Beers, who had lived experience with mental illness. Right at this point in time, we would probably call his condition a bipolar condition. And he spent a considerable amount of time in his adulthood living in what used to be called asylums, but what we would now consider to be a psychiatric hospital. He founded this organization when he was released and wrote an autobiography about his experiences living in asylums and how inhumane and inhumane they were and the poor conditions. And his autobiography fell into the hands of physicians across the country, and they empathized with his plight and followed his lead on reforming asylums and making them more conducive to well-being and healing and more humane. And so I follow in Clifford Beers's footsteps as a person who also has lived experience with mental health conditions. And so that is how I approach this work. I approach this work from a patient's perspective, and that's what we do. We advocate on behalf of patients through policy work, lobbying at the State House, public education programming, community research projects, and advocacy. For too long in Rhode Island, people with disabilities have been unnecessarily institutionalized because the state has not invested in community services and housing options needed to help them live full and integrated lives in our community. So many Rhode Islanders have been educated in segregated schools and classrooms or lost their children when they could have parented if they only had supports. They've spent days in day programs instead of being employed, or they've been arrested and incarcerated for behavior related to untreated mental illness. Many others are homeless and continually cycle between homeless shelters, emergency room departments, courtrooms, and incarceration. So before the pandemic, the Rhode Island Homeless Information Management Services reported that 63% of our homeless population were Rhode Islanders who lived with disabilities. The pandemic has changed this statistic. So now we're seeing more families who have become homeless in the last 2 years. But that number has been decreasing with legislation to make affordable housing more accessible, and also because now that the pandemic is, I guess, livable at this point, people are going back to work. We know that across the country, and it's true also in Rhode Island, that between 15 to 20% of our inmates have a serious persistent mental illness. Between 4 and 10% of them also have intellectual or developmental disabilities. And you can compare that statistic to the general population, in which 1.5% of adults will live with a developmental disability. Our state has about 10,000 individuals with intellectual developmental disabilities, but only 4,000 of them are on BHDDH's rolls. In other words, only 4,000 are getting services from the state. The remaining 6,000 individuals are not receiving services and might be living at home with aging parents, or they could be in prison, or they could be homeless. Olmstead refers to a United States Supreme Court ruling in 1999, which found that segregation of people with disabilities is discrimination under the Americans with Disabilities Act. The court decided that states have a legal obligation to ensure that individuals with disabilities have the opportunity to live, work, and receive services in the community in the least restrictive setting of their choice, permitted by their disabilities. People with disabilities cannot be hidden away in institutions like prisons, hospitals, or nursing homes. The Supreme Court decision also noted that to comply with the Americans with Disabilities Act, services in the state must be provided and appropriate to each individual's needs. And the individual must not oppose community-based treatment. In other words, it's their choice if they want to live in a more restrictive setting that makes them feel safer or more stably housed. So as long as they do not oppose community-based treatment, they should receive treatment in the community. And our community services have to be reasonably accommodated, taking into account, of course, the state's budget and the resources available to us. The court's decision also noted that compliance with the Americans with Disabilities Act could be achieved if a state could show that it has a comprehensive and effectively working plan with wait lists that move at a reasonable pace. So if you have wait lists, for example, for group homes for people with intellectual disabilities or serious persistent mental illness, in order to actually demonstrate that you're trying to comply with the ADA, those wait lists have to actually move. People can't stay on those wait lists for years and years and years. So far, 26 states have created Olmstead plans to comply with the Americans with Disabilities Act, and 18 other states have published alternative strategies, again, in an effort to comply with the Americans with Disabilities Act. Rhode Island, however, is one of 7 states that does not have any type of a plan or strategy for cohesively addressing the needs of our vulnerable populations. And by that, I mean people with serious persistent mental illness, intellectual developmental disabilities, youth who have emotional disturbances, older adults who are at risk of unnecessary institutionalization in a nursing home, but could live at home if they only have the services in the community. So when I talk about an Olmstead plan, a gold standard for an Olmstead plan would be one that is, quote, living. And by living, we mean one that repeats in perpetuity. And so year one, the plan would call for a statewide needs assessment of our population. Who are the Rhode Islanders who need housing? Who are the Rhode Islanders who need services and treatment and resources in the community? Looking at what those unmet needs are for every vulnerable population and collecting data. And an important part of this data collection phase is having community input. So this would look like having town halls or meetings at City Hall, meetings at the State House, having perhaps electronic surveys emailed to Rhode Islanders, or perhaps having people survey people on paper in strategic locations, maybe outside of community mental health centers or other types of community places where people get services. So year one, you assess what your unmet need is, and you decide how much housing you need, how much at-home care services do you need, and so forth. And the second part of your Living Olmstead plan would be to actually make a plan. What are your unmet needs, and then how will you achieve those unmet needs? You're looking at your housing options, your community services, and the resources needed for these different populations. And so you're making a plan for how you will achieve this. So you'd say, well, let's research federal sources of funding and state sources of funding and private sources of funding. And is there a way we can bring in more revenue because we need X number of group homes so that we can help these individuals who are cycling in and out of homelessness? So you actually make a plan, which we have not done in Rhode Island. The third year of your plan, you actually put those funding streams in place so that people with disabilities have what they need to live their best lives. The fourth year of the plan, you actually implement the plan, and if it's developing group homes or rehabbing group homes or creating a psychiatric nursing home, because we have 0 psychiatric nursing homes in our state right now, or developing a new residential treatment center for adolescent girls, which we have 0 of in our state right now. So you actually implement the plan in year 4, and year 5, you evaluate your plan. What goals did we achieve, and where did we fall short, and what are still the unmet needs? So you begin again in year 6. You start with item 1, and you do another a statewide needs assessment, looking at who your population is and what are the resources they need. So it repeats in perpetuity, and in this way, the state has a more cohesive, collaborative, methodical way of looking at what we need in Rhode Island and then making a plan for getting it. Because the way we do it now in Rhode Island without an Olmstead plan is we have all these different groups, these different populations, and the people who advocate on behalf of these populations, and everyone's fighting for the same money, and everyone's trying to get the attention of our leadership, and everyone's going after perhaps the same grants, competing against one another. And there's probably a more strategic way that we can do this. And so that's what an Olmstead plan would do for Rhode Islanders. What would be included in Rhode Island's Olmstead plan? It would include supervised and supportive housing options for people with disabilities. It would include affordable housing, because many people with disabilities live with SSI or SSDI benefits. And obviously you can imagine how difficult it would be to find just general housing, affordable housing. So when you have a limited income because you receive benefits, it's really important that you have access to affordable housing. So it would include housing vouchers and the development of new affordable housing units. It would include home modification for people to help them live more comfortably and safely in their homes. So this could be something like a ramp for wheelchairs to get in and out of a home. It would include educational and employment support so that people with disabilities don't have to sit home isolated by themselves all day long. they can get out into the community, they can go to school, they can have a job, and they'll have someone with them to support them along the way. Maybe it's transportation services, or maybe it's an actual person who's sort of like an aide that, walks with them and goes to school with them and works with them and helps them do the things that are necessary for them to have successful educational and employment experiences. Transportation, of course, assistive technology, durable medical equipment, the full continuum of behavioral health treatment options. So that would be looking at outpatient level of treatment, and then, going all the way up to intensive outpatient programming, partial hospitalization, residential treatment centers, and inpatient hospitals. So looking at what we need and developing a plan so that we have a full continuum of behavioral health treatment options in Rhode Island. Our Olmstead plan would also look at community and home-based services, and make sure that we have what we need so that any older adult who wants to stay in their home can do so and won't have to go to a nursing home if they don't want to. It would also look at workforce development. So this could be looking at wages and paying off student loans to incentivize people to go into the field of health and human services. It would look at criminal justice reform and would support diverting people with disabilities from becoming arrested and incarcerated. So this could be crisis intervention training for police officers, or the CAHOOTS model. It would also take into account policy, legislative, and regulatory solutions that we might need to address in order to make all of these other things happen. And so we know that Rome wasn't built in a day. So, the first Olmstead plan we have is not going to solve every problem. It's not going to meet every unmet need. We know that some of what we need is very expensive, like group housing and residential treatment centers. And so, we would approach this in a realistic way to say, maybe we have one expensive goal for the first 5 years, and then many other smaller goals and things that can be done with little or no money, like reforming bureaucracy and making it easier to apply for these resources, for example, looking at criminal justice reform efforts, workforce development, and so forth. So, we want to approach this in a way that's fair and that our expectations are realistic. So every 5 years, maybe you have one expensive big goal, a few medium goals, and then, many smaller goals that don't cost much money. And again, it repeats every 5 years. So every 5 years, you have an opportunity to focus on a new goal. Rhode Island really needs to have an Olmstead plan because what we're doing does not work. As someone who's been a case manager, as someone who has had lots of therapy in her life, I can tell you one of the nuggets of wisdom that I've heard over and over is that if you do what you always do, you'll get what you always get. And I don't think anyone is pleased with the way our system is going right now. We know that we have a crisis in health and human services, and the state hasn't made it a priority. The state has not prioritized behavioral health care investments and building up our infrastructure for the continuum of care. And what has it gotten us? Yeah, the state hasn't paid money for those things, but has it saved money? I would argue no, because doing nothing is never free. When we don't invest in our behavioral health care system and our health system in general, when we don't invest in housing and community supports, it's penny wise and pound foolish, because it results in the overutilization of more expensive institutions like Eleanor Slater Hospital, like emergency departments, hospitalization, residential treatment centers, homeless shelters, prison and jail. And then that includes the cost of paying law enforcement officers and paying for courts and paying for the incarceration of individuals. And by the way, Medicaid and Medicare are not allowed to pay for an inmate's healthcare while they are incarcerated. So inmates' healthcare costs from treatment and tests to medications all fall on the state's budget. So doing nothing is not free, and what we're doing isn't working. And so I submit that it's time that we actually have an Olmstead plan and think about things in a more strategic way. Think about the long term. How do states get Olmstead plans? You may be wondering. Some states like to get sued by the U.S. Department of Justice for violating the Americans with Disabilities Act. Many states have gone down that road and been sued, and part of their result of that litigation is that they have to create some type of a plan or a strategy for addressing the unmet needs of vulnerable populations. Rhode Island has been sued for violating the ADA, but for narrow reasons, very narrowly defined reasons. Most recently, it was for violating the civil rights of individuals with intellectual and developmental disabilities by segregating them unnecessarily and not giving them resources that they needed for school and so forth. For forcing them to languish in day programs when they didn't want to be in a day program. And so that is still in play, actually. I think the state of Rhode Island was cited for being in contempt of the court orders. And I think we've paid millions of dollars in fines or punishment, however you want to look at it. And so again, doing nothing is not free. Other states can get an Olmstead plan through a governor's executive order or through legislation or through state budget articles. It's unclear which route Rhode Island wants to take. We were hoping that Governor Raimondo would have issued an executive order before her departure. That did not happen. We've met with Governor McKee's staff, and it was not a fruitful meeting, but we will keep on it. So far, the Olmstead Committee, which I chair and is a subcommittee of the Governor's Council on Behavioral Health, so far we have surveyed over 600 health and human service professionals in Rhode Island to ask them about what their unmet needs are. We've published 3 Providence Journal editorials. We've had 3 virtual town halls. We have a formal policy proposal that's been signed on by a number of organizations. We've met with some of our leaders. Senator DePalma, of course, is a champion for an Olmstead plan, as are many other General Assembly members. We've also testified in Senate Finance and Senate Oversight committees. And in this summer, in late July, early August, we will be having a gubernatorial forum to ask every gubernatorial candidate their stance on having an Olmstead plan and how they would implement an Olmstead plan if elected governor. We'll be asking them to share their stories of people they know who would be affected by an Olmstead plan. So if you're interested in attending this event, please sign up for our newsletter because we'll send out an invitation. This is just a sampling of some of the organizations that have endorsed our formal policy proposal to establish an Olmstead plan in Rhode Island. The Governor's Council on Behavioral Health, the Rhode Island Developmental Disabilities Council, the Governor's Commission on Disabilities, National Federation of the Blind, Mental Health Association, the Long-Term Care Coordinating Council on Behavioral Health Work Group. And others as well. I believe NAMI Rhode Island is also one of our endorsed signatories. If you feel that the state of Rhode Island would benefit from an Olmstead plan and you would like to join this fight, please call Governor McKee, please call your state representatives and ask them to implement an Olmstead plan, a comprehensive living Olmstead plan. If you are a member of an organization, I'm happy to make this presentation to your group as well, and it would be wonderful to have your organization officially endorse our proposal to establish a plan. Please sign up for the Mental Health Association's newsletter if you want to hear about action alerts related to Olmstead plans and legislation for other matters. Or you can join our Olmstead committee, which meets once a month virtually, and you can get involved in helping to plan our gubernatorial forum and other actions we'll be taking. The videos of our town halls are on our YouTube page, and you can also go to Integration for All on Mahari's website to learn a little bit more and read our editorials in the Providence Journal. And I'm happy to answer any questions or take any suggestions or input you might have.
So there are a few questions in the chat. The first question is, why no plan in Rhode Island?
Great question. Folks have been trying for many years to get an Olmstead plan in Rhode Island, and the state has resisted because the state does not want to commit to spending money. So if we have an Olmstead plan, the state has to follow the Olmstead plan, and that would mean actually investing in psychiatric nursing homes and group homes for people with disabilities and community services and transportation and all those other things that would be in our plan. And the state does not want to financially commit to that.
The next question is, what's stopping the Olmstead plan?
Thank you. Thank you so much. It's actually the money. Again, it's the state does not want to have a plan and have to follow a plan because it doesn't want to have to commit resources. Mind you, we have a surplus of $800 million in Rhode Island as we speak, between federal funding and state taxes that ended up being more than anticipated. So I really have to think that it's a matter of values. What we fund and what we don't fund, I think demonstrates what our values are. And I don't think our leadership values Olmstead plans or the Americans with Disabilities Act. And I don't think that the vulnerable populations like youth with emotional disturbances or older Rhode Islanders or people with disabilities, I don't think our leaders prioritize these populations.
Tammy's comment was, proactive is a better choice. True. And good golly, RI sucks.
Well, I'm sorry, I don't mean to be negative. But it does seem like, Rhode Island is one of 7 states in the country that does not have an Olmstead plan. And that is frustrating and embarrassing and sad. So again, if you care about this issue, I really encourage you to reach out to your state representative and Speaker Shekarchi and Governor McKee. Nothing happens in the state without Speaker Shekarchi's seal of approval and Governor McKee's seal of approval. So, we have many wonderful, forward-thinking, compassionate General Assembly members, but they're usually not the ones with the most power. So I encourage you to call your state rep and express your concern about not having an Olmstead plan, and to call Speaker Shekarchi's office and to call Governor McKee's office.
Thank you. It doesn't seem like there's any more questions in the chat. Tammy says that she definitely will call the governor's office. And Shekarchi?
Speaker Shekarchi, yep. Thank you so much. That would be wonderful. Your voice makes a difference. Our elected officials care about voters, and so you have a lot of power, and I encourage you to use it. Any other questions or comments or suggestions? Okay. Well, thank you all very much. And please sign up for our newsletter. And if you'd like to get involved, I'll put my email address in the chat. And you can certainly attend our Olmstead Coalition meetings. There's my email. And hopefully I'll see you all soon. Thank you so much for this opportunity.